I think anyone who smokes pot can tell I don't know how to smoke pot.
But you've admitted that you have a ketamine prescription.
Yeah.
What's that for?
Well, I mean, it's pretty private to ask somebody about a medical prescription, you know. But I think it's something I'd say, like, there are times when I have sort of, I don't know, like a negative chemical state in my brain, like depression, I guess, you know, or like depression that's not linked to any negative views, and then ketamine is helpful for getting one out of a negative frame of mind.
Well, listen,
So in fact, I generally, obviously I'm not a doctor, but I would say if someone has depression issues, they should consider talking to their doctor about ketamine instead of SSRIs.
listen, I think that ketamine and drug therapy is increasingly becoming more in the mainstream.
Yeah.
Do you think you're doing it under a doctor's care, right?
Yeah. Literally a prescription from an actual, a real doctor, not like, you know.
Yeah. But do you feel like you ever abuse it?
I don't think so. If you use too much ketamine, you can't really get work done. So I have a lot of work. So I'm typically putting in, like, you know, 16-hour days. That's normal for me. And it's rare for me to even take off a weekend day. So I don't really have, like, you know, a situation where I can be not mentally acute for an extended period of time. Like, I can't really get wasted because I can't get my work done.
So how often do you take it?
Well, it'd be like a small amount once every other week or something like that.
But there's not on the bottle where it says take this dose this many times a week or whatever. If it's not a doctor's
dose. And there are several weeks will go by where I don't use it.
You don't use it.
Yeah, I think it's like I said. I think what I find ketamine is if you're like literally like a chemical state in your brain that you can't just think yourself out of, then ketamine is helpful for getting you out of a depressive mind state.
You suffer from depression, or you have a depressive mind state? And I asked you as someone who has suffered from depression.
I wouldn't say that I wouldn't say that I have like a case of like extended depression. It's just once in a while I get into a negative sort of chemical mind state. Once in a while, it's not a common thing, but once in a while it does happen.
Where do you think that comes from?
I think it's just genetic, basically.
You think it's just genetic history?
I think so. Yeah, I mean, some people are just wired to be happy all the time.